Hello. Today we will be discussing cholera by Marie Canfield, Emily Huff, Erin McGahey, and Bailey Predko. So what causes cholera? The causative agent of cholera is Vibrio cholerae. The two serogroups that most frequently cause the disease are O1 and O139. Some basic characteristics of Vibrio cholerae is that it is a gram-negative bacteria with a curved rod shape. It has a singular polar flagellum, which makes it very motile. Vibrio cholerae is a facultative anaerobe and is able to withstand alkaline environments but is sensitive to acidic conditions. Vibrio cholerae produces an enterotoxin called cholera toxin, which targets intestinal mucosa. It does this by binding to the cells of intestinal mucosa and causes an increase in the amount of water that exits cells, leading to diarrhea.
If I was trying to find cholera, where should I look? The answer is probably water. Exactly why cholera loves water will be expanded on in another slide. But cholera is usually found in water that has been contaminated with feces from someone who was infected with the bacteria. Contaminated waters are usually found and spread in places that have inadequate water treatment, poor sanitation, and inadequate hygiene, making it less likely for cholera to be found in developed countries with better water treatments. Cholera is especially found in brackish rivers and coastal waters where animal life ingests the bacteria. So, you should probably be wary of eating raw fish from the coast of Mexico, as these fish probably have ingested and are carrying the bacteria. Cholera is an indirect transmission. This means that having contact with someone that is infected with cholera will not give you the disease. The actual route of transmission is fecal-oral. What this means is that cholera that infected feces is deposited into a source of water that is unsuspectingly digested by a victim from this water. It is from there that the disease is transmitted. And because water makes up 70% of the world, cholera travels easily and quickly, allowing cholera to spread and continue the cycle. Like before mentioned, fish also find their nutritional source in such waters and ingest the bacteria, making them a vessel to the disease towards a human host. Cholera outbreaks. Because water is all over the world, there will always be a risk for contracting cholera. However, in developed countries such as the US, the risk is greatly decreased. Regions with the greatest risk include populations that are overpopulated and those living in refugee settings with poor sanitation, allowing cholera to fester. Though the rate of incidence in the US is low, it is not unheard of due to Americans traveling and being uneducated to the risk of cholera and where they travel to, and being unaware of the risks of ingesting raw fish, especially from bodies of water on the coasts. Environmental factors. Vibrio is the cholera bacterium. It survives solely due to its aquatic environment. They survive by interacting with copepods and developing biofilms that strengthen them even during interepidemic periods. It is because of these copepods that Vibrio are able to produce clinical cholera, this being what actually gives humans the disease. And it is because of these biofilms that instead of needing a significant amount of Vibrio, usually 1,000 to 100,000 Vibrio to produce clinical cholera, there only needs to be 1 to 10 copepods to lead to the cholera disease and its transmission.
Cholera is characterized as an acute diarrheal illness. In most cases, the symptoms are mild and it can go undetected. Approximately 1 in 10 people, or 5 to 10% of cases, can develop severe, life-threatening symptoms. These severe symptoms include profuse watery diarrhea, sometimes described as rice water stools, vomiting, and dehydration. With dehydration, you can see classic manifestations such as increased thirst, rapid weight loss, loss of skin elasticity, dry mucous membranes, and low blood pressure. People with severe cholera can develop acute renal failure, severe electrolyte imbalances, and coma. Also, untreated severe dehydration can rapidly lead to shock and death within hours. It is also important to note that even though symptoms may be mild, those infected can still transmit the illness. Onset of cholera symptoms can be as soon as a few hours or as long as 5 days following the infection. There are 3 main diagnostic procedures that can be done to diagnose cholera. The first is a self-assessment to just recognize the telltale signs of cholera, like rice water stools and dehydration. If the symptoms aren't present or aren't as severe, a stool sample can be taken and tested for Vibrio cholerae, the bacterium causing cholera. The rapid cholera or VC dipstick test accomplishes the same task of identifying the bacteria in the stools. The benefit of the test is the speed and ability to be completed virtually anywhere. So the most common treatment for cholera is oral rehydration therapy and IV fluids. This is used in a huge number of cholera cases, but in more severe cases, antibiotic chemotherapy is also used. And with the antibiotics, the most common for adults is doxycycline, and with children, azithromycin. As with any antibiotic treatment, some of the side effects can include nausea and vomiting, indigestion, abdominal pain, diarrhea, and loss of appetite. In children, zinc treatment has also been shown to help cholera symptoms. And if a person has symptomatic cholera and it's not treated, their chance of survival is only 50%. So because of this, deaths by cholera are pretty common in places where healthcare is not as easily accessible. However, for a person who does undergo antibiotic or hydration therapy, their chance of fatality from cholera reduces to only 1%. So some cholera fun facts. Up to 80% of cholera cases can be successfully treated with an oral rehydration solution, and this is a pretty affordable solution, but it's kind of hard to access in places where healthcare isn't as easily provided. Cholera is extremely preventable through vaccines and safe drinking water regulations, but no country currently requires proof of a cholera vaccination as a condition for entry to the country. And also, the 11th President of the United States, James Polk, died from untreated cholera. So here are sources that we referenced, and thank you for listening.